one of the main things, obviously, is physiological with Ibogaine. It's not just the psychological effects and the spiritual effects of the medicine, it's the actual resetting of the neurotransmitter systems that have been changed by addiction. And what we see as well is that the person is able to go into their subconscious and deal with these traumatic memories and recontextualize them and come to terms with them and let them go. We see them letting go of shame, which is a really big issue as well with addiction, just the shame of what they've done to their life, what they've done to their families, their opportunities that they've lost, and the medicines seem to wash that away and to show them that they're divine beings and that they can move forward without substances. So there's many different levels that they're effective.
One really powerful thing about psychedelic medicines is that you become your own therapist and you get to work with yourself from an unbiased perspective. When you're working with other clinicians and mentors and coaches and guides, inevitably there's always going to be some biasness. So when you're bringing your stuff out, the person next to you is going to be your sounding board, but just through their responses, through their questions, it's going to give a biased interpretation of what you're experiencing. And so when you go into these psychedelic medicines, it's just you with your psyche, you with your ego, you with your voices in your head, you with your emotions and your memories and your stories. And it's an opportunity to get real with yourself and really look at what is coming up and what does it mean for you and how might it be blocking you. So I think this is a really important thing when it comes to psychedelics, and through that experience, I think it's really a remembrance or an uncovering of the true self. And so if we're talking about addiction is many things. It's certainly not a substance and it's certainly not a behavior. Addiction is more of a mindset, it's more of a lifestyle, a culture. So when you go in there, you have the opportunity to look at how am I locked into my addiction mentally, and how am I locked into it through my lifestyle and through my culture, and how can I look at some of those belief structures that are keeping me pinned into this kind of mindset, personality, or lifestyle, and what can I do to actually change that. I think, traditionally, addiction is the belief that the solution, the meaning, the happiness comes from outside. And so that kind of mindset is going to seek a addiction treatment through the same modality, that something outside of me will heal me. We hear about Ibogaine, great, that'll fix me. Or rehab, that'll fix me. Or going to meetings, that'll fix me. But that doesn't fix a person. You have to actually go in and do the work. And these psychedelic medicines not only give you the opportunity, they actually demand and request that you're doing the work when you're in that space, because if you're not doing the work, it's not going to be a very pleasant experience.